Shayla want to jump out of the chair because that's counterproductive as well. But we're going to spot treat the areas that we know are higher concern to give a higher dose, and then we're going to do a generalized fluoride, and then we'll follow up with the home care of what she can do to just support the products that we just gave her. That makes sense? Good? Any questions so far? No? So I'm going to go in, I'm going to do my intro inspection, just make sure everything's good. Kind of weird with the camera because you have to do everything.
Do you want the light?
It won't let, they won't be able to see them.
Oh, right, it's too bright. Okay.
So.
Because I did have this lamp on, just maybe get you to open your mouth. So we can.
If that lamp works and it shows
Yeah.
the video, okay, let's try that.
Okay, so what do you think? Like that? Or
You guys can see okay?
yeah. Or like that.
Well, I can use a little bit of light, so as long as these
Okay.
guys can see. I just know when we put on the overhead
It's
light,
too much.
you can't
Yeah.
see anything.
Okay, and that's not too bright on your eyes,
No,
Shayla?
it's fine.
Okay.
Okay, you can drop it down just a little bit more. I'm short. So I'm just gonna do a quick intro exam, always. Kind of see what's going on. Just turn towards me a little bit. And close down. So we're gonna say that her 1.3 and 1.4 are really sensitive. So we're gonna put our desensitizer right first. Just open. Any of your other areas gonna give you any problems?
No, I don't think so.
So she doesn't have any generalized recession, but what she is noticing is that these two teeth are getting quite sensitive. So, sensitive to cold, what other symptoms are you having at home?
Hot stuff gives me pain.
Okay.
Eating things that are sweet and sour make it just hot, cold flashes. Feels like it's almost burning.
Okay. So, you can have a really, really little amount of recession, but as we know, once we pass that CEJ, you get really big tubules up there, right? So it's no longer like the glass finish on the enamel. We've got that porous finish. So what we're gonna do is we're gonna be applying it kind of in around there. So we are really close to the gums, but we wanna watch that we don't put too much of the desensitizing components on the tissues, because if it is one of the ones that has light curing, it's got some of the properties like bond, which can be aggravating to the tissue. So if it is one that needs to be light cured, it'll be in a little black bottle, just like anything else in restorative, okay? So the big one that you will see out there is Gluma. I'll pull it over here and show it to you after. They have a light cure and they have a non-light curing one. Both are really, they work really, really well, but they're quite hard on the tissues. So it's kind of that fine balance of like, I want to be really close to the tissues, but I also don't want to like stress them out and be burnishing into that area. So I'm going to keep it more on the cervical third. I'm going to draw it across up as close to I can as the tissues, but I don't want to be like, oh, I'll just run it right across and hit the incisive papilla. Good so far? So Shayla, I'll get you to just turn a little bit away from me. I'm just going to get it open. So I'm just going to isolate that one localized area right now for the desensitizing, and then I'm going to isolate everything for the fluoride varnish after. So I've kind of retracted. We're going to do the 3 and the 4. Is that? I'm not looking at the camera. Is it showing up okay?
Yeah.
Okay. So now, she said it's sensitive to cold, it's sensitive to hot. I need this dry, but I'm not going to pick up my triplex syringe until after I've done at least one pass, because nothing's in there doing that first level of blocking, and I'm going to send her through the roof if I get in there and I'm like, I need it dry, and I'm getting right in there. So the first pass, you're usually wiping it off with gauze, and I'm just going to let Shayla know we're going to put some desensitizer on this area. So the product we're using today, it's going to have a little bit of a yellow, or this one's pink. It's going to have a pink consistency today. So you're not going to brush it off until you go to bed tonight. So it will be visible when you're smiling and talking with people through the day. But the longer we leave it on there, the more that material can soak into those teeth. So we've probably explained that to Shayla before she's come in for her hot pink tooth application. But what we're going to do is we're going to go in, I'm going to pat it dry. I don't want to rub and be aggressive. I just need the extra saliva that's pooling around those teeth and those tissues to go away, okay? So So I'm just going to lightly dry the area, and then I'm going to do one pass with my desensitizer and my little micro brush. So if you just stay like that. I'm not going to rinse this away. This stuff spreads out really thin, so you don't need a ton on your little micro brush when you're working on each other today. And we're going to go in, and I'm just going to place it at the cervical third. Okay, so I'm not going to draw this all along the teeth, but I'm going to start at the cervical third and then go up as much as I can towards the gum line, adjacent to the gum line, but I'm not going up and over the incisors papilla or rubbing it all around. Can you guys want to turn your chin down a little bit? Can you guys see that a bit more?
No.
Turn towards, away from me a bit more. Is that showing up?
Yeah.
Okay, so what I've done is I've applied it right here and right here on the 3. Okay, so now what I'm going to do is I'm just going to take some time and I'm burnishing it in, right? So I'm trying to take that material and push it into those open tubules. So I'm going to burnish it in and I'm going to give it a little massage. Are you doing okay?
Mm-hmm.
So this shouldn't bother her because this is room temperature and I'm just wiping it back and forth gently. And I'm doing that for quite a few passes simply because every single pass, think about your little dish soap at home and your sponge. You smear a little bit of soap on it and then put a little bit more, it's going to build up and it's going to block those little holes, right? So we're trying to include those openings right along that gum line. So cervical third and then right along the gum line, adjacent to the tissues but not dripping over. So now, Shayla, no, I'm just going to give it a light burst of air just to really push that material into those tubules. Let me know if this bothers you too much. I'm going to just do a really light one. So I always want to practice out of habit because it doesn't take much for there to be a little bit of water in here and then you just sprayed off everything you've used. And I'm just going to do a little light, like I'm barely, oh. I'm barely hitting it, but I'm moving the chair. Are you okay? Sorry. So I'm just going to do a little light air to now dry that material and kind of, it'll push it lightly into those areas. So I'm kind of going across the tooth, I'm not going straight in. That makes sense? Because that's usually when they're not going to like me. Now, usually one pass is going to bring it down a fair bit. We're going to do 2. Because we want to really make sure that this product gives her a really, really good jump start in the area before we move on. So I'm going to go back in, I'm going to do the exact same thing. I'm just kind of going across and I'm patting it across, drawing my micro brush back and forth, and every single time it's pushing it into those little tubules. And we're putting a nice thick layer on right along the cervical third. I'm close to her tissues, but I'm trying not to pull and get in there though. Some will be a paste, some will be a light cure, but that's kind of the idea. Okay, so I'm going to do one more little burst of air, and this time I might be a little bit more with it just because she's had now 2 layers coating it. And we're just going to dry that right out. Doing okay? So now if that was puddled too much, I'd be pushing that into the tissue. So less is more. If you have to do a 3rd coat, do a 3rd coat, but just kind of be more precise about your placement versus the product. Okay? More application slowly is going to just be nicer for our tissues anyways, and it doesn't hurt anything. You can close down for a sec. And then, another word.
Full stop.
No, I was going to lead into something else with it. Oh, so if this was in a little black bottle, I would now light cure it. So I'm not going to light cure between the 2 layers because I want to have a really good adequate time to really push that material into those occlusions of those open tubules. So if I cured it after the 1st dose, now it's going to be harder for me to get that 2nd pass into the area. So you're always going to do 2 applications and then either leave it and then do post-op, or right now we're going to follow up. I'm going to do Shayla's fluoride and then I'll do the post-op at the end for her because we're going to do a full treatment. So if it was one that didn't need light cure, then we would just leave it as is.
Did you need one of these? I don't see one.
Oh, I was going to use the Opticate.
Oh, perfect. Nice. Well, maybe you can just show them.
I can show both.
Yeah.
So just because Shayla's not actually needing this, I'm going to wipe off a little bit of that extra. Doing okay?
Uh-huh.
The rest will come off with the protein. So any questions on the desensitizing? So I'd go around and I would treat any of the areas that would need this right now. Like I said, we're not drawing it all the way up the mid and then sizal or the occlusal edge because it's at the cervical, closer to the CEJ where we've got recession and we've got some of the tubules open that we're trying to treat. So then now we would go in and we would do a full mouth fluoride varnish because we've gotten that first layer into those areas that needed the higher dose, and now we're going to do a generalized dosage everywhere else. Good so far? Perfect. So I'm going to just wet this and take out the little cotton. Trimming it on. Are there compressors on?
Probably not.
Are there?
Sounds like it. Oh, they're hissing. Someone's got one of the traps upside down.
Oh,
Yeah.
okay. So now, before I give you a ton of water, right? Just turn towards me. I'm just gonna lightly wet that. I'm not gonna use a ton of water because my suction's not working quite the way I want it to. It's struggling there a little bit. Nothing like in the middle of a demo. Okay, so now we're going to go in and we're going to do a full fluoride varnish. So we're going to be using the toothpaste today. We're going to do a full dose. Any allergies to any flavors or anything? No. So we are going to use simulation today, and I'm going to show you the different types of retraction first. So we want to make sure we are retracting away the tissues, and you're not going to be able to do full mouth cotton rolls on every single person because then you have to wet it and take it out. There are going to be some applications where with little kids, if one of these retractors don't work, we might isolate it by quadrant and paint it on. Just the big thing is, why do we want to retract before we're placing the fluoride? Any guesses? Everyone's so lively this afternoon. So what happens when our saliva is really prevalent in our mouth, guys?
So,
What does our saliva do? It washes away things. So let's just say Shayla had a lot of saliva built up in her mouth. Most of our patients, as soon as we lean them back and we do our polish and we've introduced all these different flavors, there's a lot of saliva built. So what we don't want is saliva pooling in areas and now diluting the product. With the fluoride varnish, as soon as it hits the saliva, it gels. So if it hits the saliva before it's really adhered to the tooth, it's going to gel, but it's not really going to give it that great of an application, right? So there's two different types of retractors that we have. We have the Octagate. So this one's kind of, it'll go in, you bend it down, and it's going to go in or inside, and this little ring goes on the outside, and it holds their lips out of the way. It is. Or there's, sorry, I'm going to reach right across you. So there's two different kinds, and then there's different sizes of these ones. Everyone's seen these from Speak Out?
Yeah.
Right? So same sort of idea. This goes at the bottom of the chin, and you're going to place it in. You always kind of bend it. And you're going in side to side. So do you mind? I'm going to make you really be a guinea pig. I'm going to show them both. So I'll show you. You place both. So I always give it a little bit of tension. Can you guys see that? Am I on the screen? Yeah. Tension at the bottom. So this bigger lip goes on the inside. This goes on the outside. So this is going to kind of go in, tuck into their cheeks, and really reflect their lips out. Now I'm not going to go in straight. I'm going to go in and do one side and then do the other. So this is where, if you have really little kids coming into an inpatient care clinic, we do have smaller sizes. The Optogate's in one size. So it's going to be more adult driven. Teenagers and up, they'll probably be fine in that one. It is nice as much as it looks obtrusive because it's all really, really soft edges, right? But those are not going to fit into your 6-year-old's mouth. So we've got pedo sizes of this retractor Or if you got really, really little, this is when you will go in and do some cotton roll isolation and kind of try to do like one side and then the other. Everyone's like, great. I don't know what's going on with all of our sessions and
I think it's upside down, right? The trap.
yeah, it sounded like it. So what you're gonna do is I'm gonna let Shayla know I'm gonna be putting this little retractor in. It's gonna be really cumbersome in the beginning. As soon as it's in, you can close down a little bit. It'll tuck into those corners a bit nicer, okay? So I'm gonna go in. I'm gonna slide it under her cheek and position one side first, and then I'm going to bend the other side and go in and under her cheek in the other corner. Close down just a little. Now if you close down just slightly more, so she can close down, her teeth are all exposed nicely, and her lips and her cheeks are out of my way.
You're cute, Shayla.
Yeah, it looks great. Got a really nice smile going on there. So the idea is when they close down a little bit more, just slightly there, I can dry off all these teeth and I have really nice isolation to do direct application. You're gonna get better moisture control on the buccals, okay? But we are gonna place it on the linguals as well. So I'm gonna open slightly and I'm gonna tuck that one out and I'm gonna show the other lovely one because you get to be my super demo today.
Woohoo.
So same sort of idea with this one. It works really well if you pinch it in the middle and then bend it in. Can you guys see that? Oh, I went off the screen. So pinch in the middle and then it's going to bend in. These little tags go on the outside. Now whether you put them tags up or tags down, they're actually little tags down. It says Ivoclar on it, so if you follow the reading, that's more ideal, but I've seen it work both ways. So this one you're going to pinch in the middle and then you're going to bend it in side to side. So this one gives you a little bit more lip retraction, but it's the same sort of idea, okay? I'm going to place that in.
Are we using these on each other?
You are.
Fun.
We'll be using these all through patient care clinic. Close down just a little, just so it's not pulling on your cheeks. And you're just massaging the lips out of the way. You doing okay?
Mm-hmm.
Oh, that was my cool.
There is another one. Oh, so those tags go on the bottom?
Yeah.
Yeah, ideally.
Close down just a little. Perfect. These ones like to sneak out, so a lot of people do like the other retractors a bit better, but these are comfortable for the patients once they kind of tuck in. Kind
Did
of.
you mention that we want them to have at least one experience with the
I
Optigate?
was mentioning that they will be using them on each other.
Yeah, just once though, I was told this morning.
Close down
Like
just
that
a little.
one?
Well, these
No,
ones are
either
disposable,
one.
right?
Disposable
So just trying to get Shayla's little lip to kind of curl around it.
Yeah, some people love these. It's just operator preference, right?
There we go. Bit better. You'll see these come out a lot for whitening treatments in office. And if you close down just a little bit more, doing okay?
Mm-hmm.
It's the same sort of concept. The other one actually fits Shayla's mouth a bit better, so this is where you're gonna find you have a preference to one versus the other. There we go. And it goes up and over her lips. So she's gonna close down a bit more, and then right now, so I'm gonna go ahead and I'm gonna use some air to dry off the rest of her teeth to make sure they're nice and dry so we don't have any puddles. We've already desensitized the one area that's bothering her. Patients will notice sensitivity more that they probably weren't aware that they had, because how often are we retracting all of our lips and blasting air? Usually we're not,
Not really.
right? Even when you brush your teeth, you are being very protective of areas. My lower anterior teeth are very sensitive, and I don't notice it until I'm at the dental office and they're poking it with air. So I'm gonna go along. I'm just gonna do some light air. You doing okay?
Mm-hmm.
So just enough that it's puddle free so I can get right to the teeth. Now we've already done our polish, we've already done our desensitizing, and now we're just applying the fluoride. So today I'm going to be using some toothpaste on Shayla. So I'm going to dry the outsides, apply it, and then I'll get her to open a bit more and I'll dry the insides and then apply it, okay? So I'm just going to do a couple sections. here, because it's not with the fluoride varnish. Just turn towards me a little bit. I'm just going to retract. You know, it is pretty nice because you're just brushing it on generously across all the teeth. It doesn't take very long to actually apply. Oh,
Why are you
a
applying?
dose. As my little retractor came out. You know,
I have a
back through the-
question.
Yeah.
Why aren't we using like the Profi cup
Like, why are we applying with the brush
brush,
first?
the micro brush?
Because you don't Profi on fluoride treatment. Like you've done the Profi with Profi paste, right?
Yeah.
Which has some fluoride in it.
Okay.
Everything's gonna go wrong now. This video's going. Doing okay?
Mhm.
Fluoride. It's not Profi.
Oh, okay.
Yeah, no, I'm not. You've already done the fluoride or the Profi, right?
Proofreading? Okay. So
And close down.
No fluoride in it.
Just make it a bit better. You
Mhm.
okay?
Mhm.
No, this is
It's funny 'cause some people love those other ones, but I find them actually a little bit more.
desensitizing and then
Mhm.
fluoride varnish, right?
Yeah, so we're just doing the fluoride varnish part, right?
Ah.
You've already done your Profi. So now we're just applying the fluoride varnish, which we want dry because it gels as soon as it hits the saliva. So I'm just gonna brush it on, and you don't need a ton. Like it spreads just as easily as a toothpaste does. So just turn towards me. So I'm gonna go along and I'm gonna do all the buckles. I'm brushing on a generous amount. And then as soon as she closes down, when I remove this retractor, it'll gel with her saliva. So it'll look a little bit sticky,
Yeah, because caramel food.
even though we've just cleaned it.
Mine's nasty.
Oh, really? Mine was caramel.
Doing okay?
Mhm.
Thanks for being so good about my retractors coming out.
Did you hear that? Jacinda had caramel flavor.
Yeah. Oh yeah, they come in caramel,
pretty good.
That is
melon,
so cool.
mint.
Yummy.
Caramel's a really big one. I think that's Voco. All the different brands have different flavors.
That's lit. I want vanilla.
Well, they were like,
I want vanilla ice cream.
do you like caramel? I was like, I don't know, that's a good idea for me, because then I'll be like licking it out with my teeth.
So when we're applying this fluoride, unlike the desensitizer, I'm applying it all over the tooth. Okay?
On that occlusal surface too.
I will be, yeah,
Okay,
at the
so
end.
just buckle first.
So I always do buckle, and then I'm going to wrap around the lingual.
How much action is
Yeah, I like that retractor.
Yeah, this one's actually
Mhm.
easier.
Yeah.
Patient likes it better. Yeah, yeah. Just open a little bit for me. You okay? So I'm just going to give it a light dry on the one side. So the fluoride varnish is a little bit forgiving, but we just don't want huge, huge puddles, okay? So I'm going to go in and dry the inside.
How long do you have to leave it on for?
This is the one that they're going to brush off when they get home.
Okay.
So if we are seeing Shayla at 5 o'clock and we want this to be on for 4 hours, we may tell her not to brush tonight.
With a spoon.
Turn right towards me.
That's what we told you.
And like I said, it goes on the same consistency as this toothpaste. So you are able to apply it quite quickly. And you are going along all the surfaces. And tickling all of her palate. Doing okay?
Mhm.
More the brush that probably bothers people than anything else.
Yeah.
Just turn away from me. Perfect. I'm gonna go right in against your tongue. It's gonna feel minty fresh. Chin down just a little bit. Perfect. And just turn right towards me. So I brushed it on all the buckles, all the linguals, and now I'm gonna go. I'm just gonna do open nice and wide on the occlusal surfaces. So this is where it's gonna feel sticky and a little bit crunchy to little kids because they're biting into it. Any questions so far, guys?
No.
Ready, go.
We're just talking if she needs suction or not.
I know. She's probably loving me right now. So, and then I'm going to take this out, and then I'm going to go over post-op with Shayla. So I'm just going to finish off the fluoride varnish, and then I'll show you guys the trays, okay? Just so that Shayla doesn't have to sit here with this in while I'm talking. So I'm going to take that out. Best feeling in the world, right? And so this is when I'm going to sit her up, and I'm going to say, so your teeth are going to feel a little bit sticky. They might feel a little bit tacky even when you're biting together because we've put the fluoride varnish right on the chewing surfaces. You can have something like water to drink right away, softer foods, but nothing crunchy or nothing really hot because the hot will dissolve it off. So we want to sit on there for at least 4 to 6 hours. So we're going to pretend she came in at 5. Do you go to bed early or later?
Later.
Later? Okay, so you are going to brush tonight before you go to bed. But if we have little kids in the chair and we see them at 5 and they're going to bed at 7:30, this is the only time we're going to say it needs to sit on there for a minimum of 4 hours. We're going to have them brush the next day. It's the only time at the dental office we're going to tell you not to brush, because otherwise they're like, I don't have to brush at daytime ever again. The girl said it. So this is when we go and explain to mom and dad. Nothing too crunchy. Usually little kids aren't having super hot, but the one time you don't say it, it'll be the time they go home and they have soup or they got a hot chocolate as a treat. So, you know, cold fluids, softer diet, anything that's going to be crunchy or scrape is going to scrape it off the surface of the teeth. Okay, so that would be kind of her post-op just for the fluoride varnish. So they can have something to eat and drink right away, because as her saliva is hitting it right now, it's gelling and it's hardening to the teeth. So I was also let the parents know, or the patient if it's an adult patient. You know, we've gone through, we've done your polish, we've desensitized this one area. Everything looks really great, but now we put this fluoride varnish on, which is going to look really sticky. So your teeth are clean, but just so you know, that's what it is. And that's what's funny. How are you doing with that flavor? It is the gum detoxifier. It's a nice toothpaste. Maybe not what you were going for today. Okay, so
I actually don't mind it.
any questions on the desensitizer or the varnish so far?
No.
No. Everyone understands why we do the desensitizer first.
Yes.
So I'm going to let Shayla know as well. So we've done the fluoride varnish. We want to leave that on for 4 to 6 hours. Same thing with the desensitizer. Okay, so we don't want you to brush that area at all. It does take anywhere from a couple days to a couple weeks for the desensitizer to kick in. So all it is it's a higher dose of a mechanical block with the fluoride, the sodium, and the calcium, or the phosphorus and the calcium that are going to get into those areas, and it's going to mechanically block it. Everyone varies on how long it's going to last. It can be anywhere from 3 months to 6 months, just depending on kind of the home care stuff that gets wrapped into it. So I'm going to give Shayla a sample of Sensodyne. She's going to go home. She's going to start brushing with that. We've done a jump start with the desensitizer. Now she's going to bring in the desensitizing fluoride. Remember how I said there's the minerals that kind of start building up and start occluding those tubules with exposure. So it'll take a few weeks for the desensitizing toothpaste to kick in. Big thing to do is once you start finding one works, stick with the same family. So if it's Sensodyne, if it's Colgate, they all use different recipes, so they will all work, but they won't work together if you're constantly flipping products. Okay, so what they're going to do is it's cumulative. So with the fluoride, every single time you use it, there's a little bit that stays and does what we need it to do, and the rest gets washed away with your saliva. So we want that constant exposure, so we're getting that cumulative buildup of those minerals to occlude those tubules. So if she's going home and she's using that, she can either brush all of her teeth, or she can brush her teeth with her regular toothpaste. Not everyone loves the desensitizing toothpaste. They don't foam up. They don't taste as good. So if she didn't have a lot of other areas other than that one, I would say here's a sample. Use it like an ointment. Brush your teeth. If you don't like the flavor of this one, you can't use it for all of your teeth. Brush your teeth like you normally do. Put some on your finger. Rub it in like an ointment. It's going to give you the same effect because we're still putting that exposure of that fluoride into that area. So some people will use it like an ointment. Some will brush everywhere and do an extra dose because they know it's hypersensitive. So let's just say she does that. She goes home, she uses her Sensodyne toothpaste every single day religiously, brings down all of her sensitivity, she puts a little bit extra in her finger and she's rubbing it in. that's kind of what we're doing with the desensitizer. So her one dose that we did today might last 6 months because she's really carrying forward the home care that's going to go with it. Now, if she does nothing at home, doesn't change anything about it, and relies just on this product, it might be closer to 2 months that she's noticing, because our saliva will constantly